Are you a mom-to-be, often gazing at your growing belly, pondering if you will go the natural route or if a cesarean, also called C-section, might be in your cards? Worried about those legendary labor pains and wondering just how long, intense, or magical the process might be? Well, fasten your seatbelts because today we're unraveling these questions, busting myths, and providing you with the information you need to navigate this crucial decision. Whether you're expecting, know someone who is, or are just plain curious, this episode promises to enlighten and engage. Hello, wonderful viewers, and welcome back to Miss Pregnancy. As you may have already understood, today we're addressing one of the most debated topics in maternity, normal delivery or cesarean. Right before we embark on this journey, do us a favor, hit that subscribe button, give us a thumbs up, and drop your thoughts in the comments. Every click supports us in bringing more content like this your way. Without further delay, let's get started. Understanding birth methods. Let's quickly overview these two birth methods. The natural birth. This is when your baby makes its grand entrance into the world through the natural vaginal pathway. It is the oldest method in the book. Cesarean, often called C-section, is when the baby is introduced to the world after making an incision in the mother's abdomen and then the uterus. Choosing a cesarean, a deep dive into the decision. So, why would someone opt for a cesarean? Cesarean sections, as mentioned earlier, are surgical procedures used to deliver a baby. The reasons to opt for this method can be multifaceted. Understanding them can empower mothers-to-be to make informed decisions about their birthing experience. Let's explore these reasons in depth. Types of C-sections, a broad overview. So, cesarean deliveries primarily fall into two categories based on their timing and the reasons behind the decision. There is what we call the elective C-section, and then there is the emergency C-section. Let's take a look first at the elective C-section. This method is predetermined, with the surgery scheduled in advance due to various reasons that might make natural birth challenging or riskier. Here is a deeper look into some common motivations. Size and positioning discrepancies. Sometimes the baby grows significantly larger than average, or the mother's pelvis might be naturally smaller. This condition can make a vaginal delivery difficult or even dangerous, hence opting for a C-section may be a safer route. Placenta-related concerns. The placenta is the baby's lifeline in the womb, supplying it with nutrients. When the placenta situates itself in the lower part of the uterus, it poses a risk of premature detachment during a natural birth, leading to potential complications. This phenomenon is known as a placenta previa. Baby's orientation. A baby ideally positions itself head down, readying itself for a vaginal birth. However, in cases where the baby is breech, which means head up, or transversely, means sideways, a C-section might be the safer route. Mother's health conditions. Specific infections, like herpes for instance, can get transmitted from the mother to the baby during a vaginal birth. In such scenarios, a C-section can prevent this transmission. Past uterine surgeries. If a mother had previous surgeries on her uterus, like fibroid removal for instance, or even past C-sections, the scar tissue might make vaginal delivery riskier. Okay, so now you've gathered an idea behind some of the common motives of the elective C-section. Let's move on into the emergency C-section. As the name suggests, these are unplanned and come into play when unforeseen complications arise during the birthing process. Some of the primary causes include baby's distress signals. The baby's health is continuously monitored during labor. If there are signs of distress, such as significant changes in heart rate, it can indicate that the baby isn't coping well. Maternal bleeding. Unexpected and severe bleeding during labor can pose a significant risk to both mother and baby, necessitating an immediate C-section. Stalled labor. In some cases, even with strong and regular contractions, the baby just doesn't move down the birth canal, a phenomenon known as a non-progressive labor. A C-section have to be performed then. mother's health surprises. Issues like a sudden spike in the mother's blood pressure or the onset of conditions like eclampsia can make continuing with a vaginal birth risky. In conclusion, the decision to opt for a cesarean is multifaceted, often rooted in ensuring the safety and well-being of both the mother and child. As medical science progresses, the lines between elective and emergency C-sections are becoming clearer, ensuring that every mother-to-be can have a birthing experience that is both safe and fulfilling. Natural versus cesarean. What's the verdict? Anything natural typically has an edge over the alternative. Natural birth often means faster recovery, fewer complications, and better immediate bonding with the baby. For babies, passing through the vaginal canal can help them clear their lungs and exposes them to the beneficial bacteria. However, if a C-section is medically advised or for whatever reasons is your preferred choice, then it is in undeniably the best interest of both mother and child. And remember, every pregnancy is unique and equally beautiful. There is no need to compare your journey with that of other moms-to-be. Show some grace, love, and compassion toward yourself and your journey, and quit being so hard on yourself. I firmly believe in the saying, if it has been given to you, then you can handle it. So, all the power is already in you, my beautiful moms. Own it. Just own it. Tips for achieving a natural birth. Based on some of your requests, we've decided to share tips for achieving a natural birth, starting with consistent doctor visits. Start your antenatal care early and ensure you're regularly checking in with your healthcare provider. Second being the dietary awareness. While eating for two, sure remember not to consume double the calories. Third, stay active. Introduce a fitness regimen that includes walking and exercises tailored for pregnant women. Fourth, education is key. Attend antenatal or prenatal yoga classes to prepare mentally and physically. Fifth, know your pain management options. Explore options like epidurals, water birth, and other options to know what suits you best. Sixth, design your birth plan. Think of it as your birthing wish list. It can cover everything from the ambience in the room to who you want by your side. Seventh, learn breathing techniques. Lamaze breathing exercises can be your best friend during labor. Eighth, have a support system. Having someone by your side, whether it is your partner, mom, or friend, can make all the difference. And finally, ninth, trust is crucial. Believe in your body's innate ability to bring life into the world. And trust your doctor. They have your best interests at heart. And so, here we go, beautiful moms. In conclusion, whether it is a natural birth or a cesarean, every mother's experience is profound and uniquely her own. It's essential to be informed, trust your body, and lean on the guidance of your healthcare providers. Remember, the journey of childbirth, regardless of how it unfolds, is a testament to the strength and resilience of all mothers. Whatever your path may be, embrace it with confidence, love, and grace. Thank you for joining us in today's deep dive into the choices and sometimes non-choices of childbirth. If you found this video helpful, please like, share, and subscribe. Until the next time, take care and cherish every moment of your pregnancy journey. Yours truly, Miss Pregnancy.